Hello everyone, welcome to From London with Love, with me, Lin Clive, on ALB UK TV. Today we are joined by Dr. Michael Aicken, an aesthetic practitioner. Hello doctor.
Hi there, thanks for having me on the show.
It's a pleasure to have you. Thank you for taking the time off to do the show with us.
No problem at all.
So Dr. Michael, would you be able to tell us more about your background for the benefit of the viewers?
Yeah, sure. So I grew up in Northern Ireland in the UK, and whenever I was 18, I went to study medicine over in Aberdeen in Scotland. And then when I finished that, I trained as a doctor further in back in Northern Ireland again. And while I was there, I soon started up an aesthetics practice in 2007. And since then, I started to come over to London quite often to run a training course. And 2.5 years ago, I moved to London, which is where I am now, and where I run a training school and a private clinic as well.
We're going to talk more in deep about your academy and the training you do. But start with like aesthetic practitioner. Would you be able to tell us more about dermal filler? What does dermal filler mean?
Sure, yeah. So dermal filler, back in the 80s and even the early 90s, the main filler around was being collagen, but now it's a thing called hyaluronic acid, which is a substance that's found naturally in the body, in the joints and in the skin, and it can be made in the lab. A synthesized version can be made and packaged into syringes, and that would be the most popular filler now since at least 2003. And that can be used to fill the cheeks, the lips, the nasolabial lines, the marionette lines, and basically any other place. Here you can see a picture of a jawline filler. Someone has had filler injected along the jawline to make that more defined.
So we use dermal filler for volume more or for wrinkles?
It can be used for both. Cheeks and lips would generally be volume, but then people, I suppose patients who are, as they get older, patients are more likely to have lines that need filled in. So things like the lipstick lines like this, or little creases in the cheeks, they can be filled with filler as well.
So that's dermal filler. And it's now a trend in a way, like everyone is going for one thing at least. What are the complications of dermal filler?
Well, there are some serious complications which only became known in the past sort of 6 or 7 years, really. But the most likely complications if somebody is to go is it's a little bit sore, which is why we would use an anesthetic cream, and that's gotten better over the years. There's a chance of bruising. That's probably the most likely side effect. Some bruising. We generally say you can't cover it up with makeup on the day, but the day afterwards you can cover it up with makeup. But the more serious complications that have come out since about the past 7 or 8 years would be filler blindness, which is pretty scary sounding. It's thought to be about 1 in 5 million maybe injections would lead to filler blindness potentially.
What is the reason of it? Like, is it like the filler material, like it's migrate to somewhere, or is it the injection itself?
It's where some people have connections in the arteries in the face where it's sort of a variation of normal. So not everyone has it, but sometimes there can be a crossover between the vessels that supply the inside of the head and vessels that supply the outside of the head. So when you inject a vessel accidentally from the outer part of the face, it can cross over and get into the artery that supplies the back of the eye, so the retina. So it's a blockage of that artery that causes it.
But it's very rare.
It's extremely rare.
Yeah.
I think everyone became more aware of it in the UK whenever there was an incident a few years back where I think a doctor had injected someone and they went blind, and that was in the UK. So that was, I think, why people became more aware of it. It hadn't really happened in the UK before.
Yeah. And that's dermal filler. So is it different to anti-wrinkle?
A lot of people who practice filler will also use botulinum toxin, and a few brand names out there. The main ones being Botox, which was the original, and then also Azilur, which would be the one I use at the minute. It's a vegan product, so it's not used on animals. The Azilur version, it's not tested on animals. And they would be for relaxing lines that are worse on movement. So typically the forehead lines, frown lines, and the crow's feet. As you can see, I don't have many of those. Not yet.
Yeah, I'm sure you take good care of yourself.
Try to. Suncream's the best treatment, I think, or the best preventative measure.
And what are the complications of it?
Well, with Botox, it's a lot less severe. I mean, the worst thing that can happen is you get a bit of dripping of an eyelid, and that'll be quite rare. If the practitioner knows what they're doing, that would be quite unusual, and it doesn't last very long if it does happen. But that's the thing people are most scared of, is their eyelids dripping for a bit. So that it's a lot safer than filler in terms of the rare complications. But overall, they're both very safe.
Yeah. In terms of age, what for Botox, what age do you think ladies will start using or advised to start using it?
So for Botox, I find in my population of patients, because I have a clinic in Belfast in Northern Ireland and also London, I find it tends to be more limited to how much money people have. So a lot of typically, I think if someone could afford it, it would be worth getting it from early 20s because it could be a preventative measure. Because if you're getting Botox, you're relaxing the muscles that are lifting up and causing the lines, or pulling in and causing the lines. So if you can relax those muscles early, you can prevent that damage being done to the skin. So if you can start that in your early 20s, that's good. A lot of women will tend, and men I suppose, will tend to come a bit later because it is a fairly expensive treatment. So, and a lot of people don't have spare cash until they're a little bit older, maybe. So.
But do you think, doctor, that non-surgical treatments cause addiction in a way? Because if we started by having this done or that done, there's always like a desire to need more and looking for always enhancement and improvement.
Yeah, well, I mean, it's certainly a rumor out there. I suppose it's not an addiction in the typical sense, like compared to someone who maybe is an alcoholic or a drug addict, where they rely on it to get by. But people do tend to, get one thing done, and then they'll tend to maybe get something else done as well the next time.
Yeah.
But I guess it's not necessarily a negative, as long as the person doesn't have a psychological disorder, where, as long as the problems they have are the things that they want to improve, as long as they can be seen objectively, like they have a line. If that bothers them, that's up to them. If they want to spend money on fixing that line, I think that's reasonable. When it comes to things like the size of people's lips or the size of people's cheeks, you start to get into territory where it's to do with how comfortable the practitioner feels with creating these big lips or these big cheeks. I haven't personally had an issue with it. I tend to offer a subtle treatment for my patients, and they all go along with that. So I haven't had to say no to anyone really who wants big lips, for example. That's never really happened to me.
Yeah.
But I think some patients will be drawn to practitioners who maybe already themselves have big lips or big cheeks or more extreme features. So it sort of hasn't been an issue for me, but I understand it is an issue out there. Especially because we need to safeguard for patients who might have a disorder such as body dysmorphic disorder, where they have an unrealistic expectation about flaws in their own face that will, other people might not be able to see, but they might really be overly concerned with those. And we need to protect those patients from going over the top and getting extreme and expensive treatments that they maybe aren't going to benefit from.
Yeah. And in terms of pregnancy, there are lots of when I promote for our show, lots of questions. I'm pregnant, I want to do lip fillers. I'm pregnant, I want to do whatever. So what's your advice, doctor?
It's a good question. I don't think there's any known risk to treating a pregnant woman with Botox or filler, but most practitioners will say no, because of the fact that in pregnancy there's always a risk that something will happen. Like a miscarriage is common. It's between sort of 25 to 30% ish, the sort of risk of miscarriage in a typical pregnancy. So if something goes wrong, a practitioner doesn't want to, I suppose, be blamed that it could be something to do with Botox or filler, even though there's no real logical or scientific reason to think that Botox or filler would cause that to happen. Nobody.
Like the safe side.
Yeah, it's to stay on the safe side. You don't want someone to feel guilty if they did have a miscarriage and they feel terrible about it. You don't want them to think, if only I didn't get my lips done. You know.
Yeah. And in terms of fat dissolving, it's also a new trend. Everyone is going like procedures for fat dissolving. So what are the things you do in regards to fat dissolving?
Yeah, so there's a couple of brands out there. The one that we train in mostly in our course is called Aqualix, and it's basically like it's a chemical which is it's almost like a soap that's injected. So chemically it would be a soap. That means it breaks down fat, destroys fat cells. So that's why you use it whenever you wash your dishes, breaks down fat on the dishes. And so this can be injected in the product. The most popular treatment is under the chin. So under this area, this little pocket called the submental fat.
Double chin.
Double chin, yeah. So it's the submental fat. That's the most popular area. Mm-hmm. But then you can get it injected into any part of your body where you can pinch, between 1.5 to 5 centimeters of fat. So other popular areas would be the backs of the arms, and then the inner and outer thighs, and maybe the lower back, the flanks, or else the tummy at the front. So there's lots of different applications for it, and it's fairly safe, I would say. Some people get little, depending on the technique that's used, some people get little lumps that they can feel, but you can't see, but they can feel them under the skin maybe for a few weeks or so. But generally speaking, people get quite good results. But it is really only for people who have problem areas. So it wouldn't be for somebody who's overweight. There are other treatments available for that kind of thing, but it wouldn't be for somebody who's overweight. It's only problem areas. So somebody who's lost all the weight, but they still have a little bit on their tummy, for example, or under the chin.
So the complication as well is not like severe in terms of fat dissolving?
No, there don't seem to be any major complications, but then it hasn't been out as long as Botox and fillers, so there's a chance that in 10 years that we might know more about some rare complications. But at the minute, we're not aware of anything that's particularly severe.
So we talked a little bit about you doing training. So would you be able to tell us more about your academy?
Yeah, sure. So we've been around since 2009. We principally train in Botox and filler, and I've been teaching a certification course, which is endorsed by some of the insurance companies. So originally I was training doctors, dentists, and nurses. Over the years, the insurance companies became a little bit more open to training other groups of professionals. So the course extended in size. So originally for doctors, dentists, and nurses, it was only a 1-day course that was required. But we eventually developed a 4-day course. And we can now train certain beauty therapists, for example, who have an NVQ level 3 or more. So that's equivalent to, I think it's about 3 years of training. And there are lots of other professional groups, but the beauty therapists would be the main, the biggest group that we would now train, other than the medics. So they do a 4-day course, so it's 2 days of online theory with little videos and reading material and little tests. And then they come to us for 2 days of assessments and training clinics in a small group. And we do that in London.
Yeah, and you do it in other locations?
Yes, we do a medics course over in Belfast still. That was the first one we started. And then we have potential to do them in Birmingham and, I suppose Birmingham is the only other place we've been doing it currently. And then I also would do some one-to-one training. So usually about half of the people I train one-to-one, I'm training in more advanced treatments. And so things like the jawline would be more advanced, jawline and chin, tear troughs, these little lines here. That would be a separate advanced course. And then also the Aqualix training. So that's the fat dissolving I would do as a one-to-one training. So all of those, for those you have to have trained in dermal filler first, that as your qualifier to get onto those advanced courses. And so that's it. That's what I offer. And since COVID, it looks like we're going to be focusing more on the one-to-one training so that we don't have big groups in the room.
So that's the plan from now.
That's the plan, but we'll see how it goes because the guidelines are changing each week. We've just been told we can reopen in about another week's time. And obviously the rules might change. So if the government says we need smaller groups, we'll keep it in small group training. if we can go back to normal, we're only training a maximum of 8 people at a time anyway at full capacity, so we might be back to that soon.
Yeah. Dr. Mike, we touched a little bit about regulation, and it's a bit of a hot topic now. Would you be able to tell us more about it? Like what's happening in terms of the regulation in regards to practicing in aesthetic?
Sure. Okay. So as you've said at the start, I'm a doctor. So I'm a doctor and I do aesthetics. But in the UK, lots of groups of people can do aesthetics. Some of them are already regulated through their own professional body. So as a doctor, I'm regulated by the General Medical Council. That means if you were coming to me for treatment and something went wrong and I refused to help you or refused to do anything or acted unprofessionally or for any reason you were upset with what happened, you could tell the General Medical Council and they would look into it, and potentially I could be struck off, so I might not be allowed to be a doctor anymore. So as part of regulation, then we realize that we need everyone who's doing Botox and fillers and any other aesthetic treatments. All of these people need to be regulated because otherwise it's dangerous for patients. So the priority at the minute, I think, needs to be on those who aren't already registered with a professional body. So if you're a doctor, dentist, or nurse, it doesn't mean you'll definitely be good at Botox and fillers, but it means that if a patient wants to complain, it's much easier for them to complain because they can complain to the regulatory body. So what we need is regulation for the non-medics in the UK, and that's something I'm working with some colleagues. We're putting together a register, and we're going to launch that soon. The issue is there are quite a lot of private companies trying to put together these registers, and I think potentially there's money to be made in putting together a register like this. And I've realized from speaking to my colleagues who are in the non-medical fields, I've realized that everyone is aware that there is money to be made, but this shouldn't be something that money is made from. This should be a charity, and it should be run from, there should be a payment made to be on the register, but it shouldn't be something where somebody's getting rich out of it. It should be something which is sort of everyone pays a membership fee, because everyone agrees this is what we need in our industry. This is what we need to protect the industry and protect our patients. So that's the way we're going with it. And it would be very much like the way as a doctor, every year I have to do an appraisal. So I'm a GP, a general practitioner. So every year I have to meet with another general practitioner who goes through certain steps with me. They check how much learning I've been doing, continued professional development. They check there's been no complaints against me. They check what types of jobs I'm doing, and just look for any. They're just looking to check that I'm a responsible practitioner, that I haven't gone crazy or I haven't stopped listening to my patients or ignoring problems, and so that's what we need, I think.
Put the patient safety and first.
Yeah, exactly. Yeah. So,
I will finish up with the last question, Doctor, about back to dermal filler. So in the market, there are lots of brands. We will not mention any of them, but how can we know if that's a good one or that's a bad one? Is there a way to know?
Yes. Well, one way is to check that there's a CE mark. So as a patient or as a client who's coming to get filler, even if you know the name of a brand that you've heard of, and the practitioner has that, it may not. It could be counterfeit. That's one thing to bear in mind. And so I think really you need to have a CE mark, which is just. I think it's acceptable throughout. It's definitely acceptable throughout Europe. I'm pretty sure it's acceptable throughout the Middle East as well. The only place really it's not acceptable is in North America because they have their own regulation there. But a CE mark. You can verify that on a website as well. If it has a number beside it, you should be able to look it up and check that it corresponds to that product. And that's one way of checking. I mean, of course, somebody could print a fake number, fake CE mark on a box, but I think that's a fairly good safety measure. So if you can ask to see that and it's on the box, and you feel comfortable with the practitioner and you've seen the work they've done, and if you've been told about them by someone you trust as well. Those are all good signs, but nothing's perfect. And eventually, when we have a register in place, we want people to be carrying an ID card, just like, if you're going to travel, you have your passport. If you're going to drive a car, you have a driving license. We think you should have an aesthetics practitioner license to practice, basically. So that would be the ultimate way of knowing that you're safe.
And if anyone wants to contact you, what is the website?
The best way to get me personally is through our training course website. So it's visageacademy@gmail.com.
Great. Dr. Michael, thank you so much for being my guest for today.
Thank you for having me.
At the end of the show, we're gonna watch a few minutes show to know more about you.
Perfect. Thanks a lot.
Thank you. And for you, my viewers, see you next week with a new episode with From London with Love. Stay safe.
Hi there, my name is Dr. Michael Aicken. I'm an aesthetics doctor in London. I'm also a part-time GP. For over 10 years, I've been offering training courses in the use of Botox and dermal filler for doctors, dentists and nurses. And over the past 5 or 6 years, I've also become involved teaching certain groups of professionals who aren't doctors, dentists and nurses how to use Botox and fillers. The main reason you'd want to train with Visage is that we really care that you're successful. Along the way, I've gained a lot of experience in giving backup support to those who I've trained. In the same way that I care about my own patients and the safety of my own patients, by extension I also care about the results that you're getting with your patients and the safety of your patients. And for that reason, I offer you unlimited support after you've trained with me. Typically this will be by email, because sometimes the questions are best answered by email, sometimes a link to an article. Sometimes you'll send me a photo and I'll be responding to that. So email seems to be the best way. And also there may be legal implications at times, but I'm happy to offer the support if you're training with us. As well as that, as well as covering the clinical content that you'll need to get started using toxin and fillers, I also on the course will teach you about business setup, specifically things like insurance, how to order product, how much to charge for your new services that you're setting up. Also how to document your work. We will also, as well as the clinical stuff, go into a lot of depth into managing complications. There aren't that many complications with toxin and fillers, but there are protocols in how to manage each one of them, and we will talk you through those and provide support for that. Why invest in aesthetics? Well, first of all, it's a very satisfying area to be in. So for example, I treated someone just the other day, they had some problems with their nose that they'd always been upset with, always felt self-conscious with, and within 5 or 10 minutes I had corrected these things on their nose. The patient saw themselves in the mirror and they cried tears of joy. They were overwhelmed by the difference that it made. And you'll find that you get that opportunity time and time again in aesthetics. You can use your skill that you've picked up on this course and very quickly provide an excellent service to a patient and see a result that for them is life-changing. As well as that, there's a lot of money to be made in aesthetics, and if you can do a good job for your patients, they will come back again, they will bring their friends and their family, and they will speak very highly of you. So I want you to achieve those results, and I will help you achieve those results if you attend our course. Zig Ziglar was a motivational speaker in the business world. In the 70s, 80s and the 90s, one of his key quotes is that every person is just one skill away from doubling their income. Perhaps attending our course and learning the skills involved with toxin and filler is the one skill that you need to learn in order to double your income. It's a 4-day course. 2 days are online, where you have access to online study modules, where we have videos, written information, and also quizzes where you can test your own knowledge. Then we bring you along to our course for another 2 days, where we assess your knowledge base, and we also run through some teaching with mannequins, and then we teach with real patients as well. So you'll be injecting real patients from the moment that you really show up, and we'll be doing that for 2 days. For Botox, we cover the basics first of all, so the forehead, the frown, the crow's feet areas, and then we look at more advanced things like the bunny lines at the side of the nose, the mouth corners, and some various other bits and pieces on the face. And we'll also, for dermal filler, we'll cover the lips, zygomatic arch, so it's the cheekbone augmentation, the nasolabial folds, the marionettes, fine lines and scars. And again, there'll be other little bits and pieces that will come up throughout the day depending on the patients that come in. And as well as all of that, as I've said, we teach you the management of complications. So that probably won't be managing things on the spot, because hopefully we won't be getting complications on the course, but we will go back over things, especially in your assessments, and we will have photos and we will have demonstrations about the complications and how to manage those things, so that you're all confident injectors, so no one can criticize you and say that you do not know how to manage complications. Well, all you need to do is click on the link below, choose a date that suits you to come along with us in London, and once you are booked onto the course, we'll give you access to the online content and you can get started today. Hopefully see you soon.